So once again, welcome everybody to our workshop, part one of how to search effectively for systematic reviews. Um, and during these two workshops, we're going to cover what exactly a systematic review is, also point out there are various flavors of reviews, talk about the need for a systematic approach, developing a suitable search strategy, be aware of other sources of information, knowing how to manage your results, and helping you to get through to the full text of articles you need to read as well. Today, we're going to focus on developing a question for review, why you would be doing scoping searches, developing your protocol, using Prisma, and using a framework to develop your search. So you can watch this video later on, and it goes through what a systematic review is, or the steps involved in it. But a systematic review is a means of identifying, evaluating, interpreting all available research relevant to a particular research question, topic area, or phenomenon of interest. Individual studies contributing to a systematic review are called primary studies, and a systematic review is a form of secondary study. So the key things you need to bear in mind when you're doing a systematic review is that it's team-based. If you're the only person and you're saying that you're doing a systematic review, you're more than likely not doing a systematic review because it's team-based. And the reason why it's team-based is to make sure that it's as robust, as comprehensive, free from bias, reproducible, etc. And it's very hard for one person to be able to guarantee that. You need to start with a clearly stated set of objectives with predefined eligibility criteria for studies. You need to have an explicit reproducible methodology. So this is kind of very different from a literature review, which you might have done in the past, and you make it up as you go along. Here you've got to start with your plan, and you have to follow that plan. You have to develop a systematic search that will try and identify all the studies that meet the eligibility criteria. You need to assess the validity of the findings in the included article, and then there's a systematic presentation and synthesis of the characteristics and findings of the included study. And these are just to reproduce again and go in a bit more detail on some of the characteristics of a systematic review. And obviously these slides will be shared with you as well. And we'll be touching among those as we go through the session. Now, and just to highlight here the difference between a systematic review and a literature review. In a systematic review, you're trying to answer a specific focused research question. In a literature review or a narrative review, you're providing a broad overview, context, or background. In a systematic review, the methodology is very strict, predefined. In a literature review, it's flexible, less structured. Your search in a systematic review is exhaustive. You're trying to find everything, and this can include grey literature. In a literature review, it's selective, not necessarily comprehensive. When dealing with bias or rigor, it's very rigorous, and the process is designed to minimize bias. In a literature review, the rigor is less, and there's that comes with a higher risk of bias as well. In a systematic review, you critically appraise all of the studies, and in the literature review, you generally don't formally appraise the literature. And one of the big differences is in the amount of time that a systematic review can take. A systematic review can take easily a year from start to finish. In literature review, it can take weeks or months. And in the outcome, there's a data synthesis in a systematic review, and often leads to a meta-analysis, which is a statistical analysis of the information. And then a literature review is descriptive, thematic, or a narrative summary. And as I said, it's team-based. So if you're being asked to do or thinking of doing it, one of the things you will be asked to do or you'll need to do is to formulate your team. And the team should be an actual team that's engaged from the start to finish, working together to make sure you've got the right question, the right protocol, the right inclusion, exclusion, the strongest search, etc. And these are the sort of the 12 steps of a systematic review. Like I said at the start, you assemble your team, you develop your research question, you think about your inclusion exclusion criteria, you plan and publish your protocol, you construct your search strategy, you search across the databases, you document the search, you manage your search results, you screen your publications, you appraise the included studies, you analyze, extract, analyze, and synthesize your data, and then you write and publish the manuscript. So there's a lot of steps that you have to follow when doing a systematic review. And the idea behind the systematic review, it ties into what's called the evidence-based pyramid. The higher you go towards the top of this pyramid, the more reliable, the more evidence-based the evidence that's been used. So you start at the bottom with background information or expert opinion. Then up top of that comes case studies, and then cohort studies, randomized control trials, systematic reviews, and meta-analyses. So all the time you go up there, more thought and introspection of the various data and evidence is conducted to make sure that you're basing your decisions based upon the quality of the information. Now we're talking here about systematic reviews, but there's actually, while systematic reviews was the progenitor of this type of reviews, it's now part of a family. So we have systematic reviews, we have rapid reviews, which is a systematic review, but you've made compromises and you've discussed those compromises. Scoping review, state-of-the-art review, systematic review, systematic search and review, systemized review, and an umbrella review. And as I said, what is a rapid review? A rapid review speeds up the process by omitting stages or making compromises. They're good for new or emerging research topics, updating previous reviews, or to assess what's already known about a practice using some systematic review methods. In all this, you'll be transparent and you will say, if you are making compromises, you will be open and upfront and say, we're using less databases, reducing it in time, whatever the limitations that you would not be doing if you're doing a full systematic review, you'd be upfront about that. The time frame can be as short as 5 weeks. You'll have a narrow question. You can use PICO. We'll talk about PICO later on. You may limit the sources that you're going to use. You're going to select your articles based upon inclusion, exclusion criteria. You're going to be critical and rigorous in your appraisal, but you will acknowledge that you're time limited. And the synthesis could be a descriptive summary or categorization, but it still could be a quantitative analysis. Scoping reviews have seen a lot of growth in the last 10 years. And initially they would have been done to identify where you would be doing a systematic review on, but increasingly they're all their own output and their preliminary assessments of the potential size and scope of the available research literature. And they're often used to look at a topic in a more broader sense. What do we know about a topic rather than the systematic review, which is trying to find a specific answer. The questions are broader and topic focused. You still need to do a protocol. You're still going to do a comprehensive search. And you're still going to select based upon inclusion exclusion criteria. And it's going to be more of a narrative synthesis of the results. And there's more information here on various kinds of reviews. So it's really important that just because you're hearing the word systematic review, it may not be a systematic review that you should be doing. So you need to figure out, what am I trying to find out? Is a systematic review the appropriate type of review to do? If it's not, what would be the best review to conduct and how do you go about it? So whichever review you do, it's really important that you read the manuals. A lot of work has been done on these reviews and a lot of very well-developed manuals going through the methodology which you've got to follow. If you don't follow the methodology, the question you have to ask yourself is, am I doing a systematic review or am I just doing a literature review? So you do need to read the manuals to understand the steps you've got to do and what you have to do in those steps. So question one, where do you think you could find information for a review? So if you could go out to menti.com and put that code into menti.com, and I want you to tell me where you think you would, if you were doing a review, or if you are doing a review, where you're looking for information. Just let me know if you've got that code and I'll open it up and put the page on the, here we go. Thank you. Okay, so we're here in OneSearch. Whoops, what happened there? Terrific. So Google Scholar, PubMed, Scopus, OneSearch, SciFinder, Science Direct, Library Guide. Web of Science, PubChem. And if you have multiple places, please do put them in. You're not restricted to just one. So one of the things we're seeing in the word cloud is there's a wide variety of sources, and that's because quite often people will be doing a lot of there's a lot of subjects being covered by a lot of people in systematic reviews. And one of the things that's really important is the assertion in the right places. So PubMed, for example, would be a very much a health-related database. But if your topic isn't health-related, then PubMed may not be the best place to search. So thanks for filling all that in. So it's great to see that you're aware of a variety. Just a couple of things I'll point out. UCD OneSearch would not be an appropriate site. The idea behind a systematic review is reproducible by anybody anywhere in the world. UCD OneSearch is just UCD, so it wouldn't be appropriate. So just be careful of that. Okay, so we're going to stop. I'll go back to the presentation. You can keep adding stuff there if you want to, but thank you very much. So these are sort of like a summary or an overview of those areas. So we saw databases, we saw grey literature appearing. There may be certain journals which are really important for your research question, but they're not caught by the databases that you're using. You can then say in your protocol that you're going to hand search these journals. So, and basically would say that I'm going to hand search journal X and journal Y, and it involves going through the table of contents of those journals and bringing in articles you think are potentially relevant that way as well. But it's clear and transparent and it's reproducible, so it's absolutely no problem with that. One of the other techniques that you can use to help gather information is what's called citation tracking or citation analysis. And this happens after you've done your screening, and you can look at the articles and see, are there any articles in the reference list at the end of those articles that you weren't already aware of? That's called backward citation analysis. Or then there is the opposite, which is forward. Who used those articles that you've discovered that you've kept in your review after they were published? And once again, those are clear and transparent. It's reproducible, so there's no problem in doing that. So I'm going to pause for a second to see if anybody has got any questions at this stage. So I thought I saw a couple of things going into chat. Scopus, yeah, thank you. There's another database to use. Terrific, thank you. Does anybody have any questions at the moment? So one question is, how many people should be in a team? So it's how big is a piece of string? It depends on the complexity of the question, how much time you've got available. It's very hard to say. Minimum would be 3, because it's always handy to have, when you're screening, one extra person to be a tiebreaker. But you've got to figure out if you've got a question that's bringing sort of a low number of results, you could need less people than if you had something that had a lot of results. So you have to figure out, and you should be teasing out what potentially is the size of the pot of literature that you've got to review or screen before you fully get started. I hope that answered your question. So the question about the citation, we'll be talking more about that on Thursday. So hopefully you've signed on for that, James, and we can talk about it at that stage. Thanks, James. Okay. Okay, so there are places to be looking for information. One other thing to point out to you is Prisma. And Prisma is, oops, something went wrong there. Let me share my screen again. So Prisma is a set of items that you would use when reporting your systematic review. So it gives you an idea of the things you should be documenting and writing about as you go along. It helps you be transparent and completely record all the elements of a systematic review. It's comprised of 2 items, a 27-item checklist and a flow chart as well. The checklist is literally, these are things you need, it's worthwhile thinking about and writing up about when you're publishing your review. The checklist, which is this, the flow chart, which is this, is a method of recording how you've gone from all the articles you discovered when you did your search down to whatever you're left after the process. There's a lot of work involved in that, and one of my key tips is keep this up to date as you're doing it. Don't wait at the very end, because what quite frequently happens is sort of you think you've done a lovely job and you've got your numbers, and then when you count them back up again, you're like, oh, I'm missing 4 or 5. So it's a good idea to sort of keep on top of that as you go through the process. Another part of Prisma is Prisma S, which is a checklist for helping you evaluate the quality of your search. So it's the 16 items you can consider about how strong and how robust your search is. And these are some of the things you'll be thinking about, sort of the databases you used. Did you do citation searching or analysis? Did you use any limits or search filters? Did you update the searches, etc.? So gives you a good foundation for thinking, have I done all I could for my search? So first of all, you need to get your question. And it's really important that you are pragmatic and realistic about your question. And pitching your question so it's something that you can answer with the resources that you've got available to you. This sort of ties back into what we're saying about how big is a team, and the resources are time, people, etc. That will be that will influence how targeted your topic is. One of the structures to help think about that is FINER. Is your question feasible? Is it answerable with the evidence you've got available? Is it interesting? Are you going to keep engaged with it through the process? Because remember, a systematic review can last up to 12 months. Is it novel? Is it something that's already been done? Is it addressing a gap in the knowledge? Is it ethical? Is it relevant? So try and think about those when you're thinking about the question that you're doing. So one of the things you should be doing while you're teasing all this out is you should be running scoping searches. And these are basic searches that you're doing to try and see how big a potential body of literature is out there for my question. But it serves other purposes as well. You can be using it to find, locate key articles. Articles you think, oh my God, this should be turning up in my results. You can also use it to find relevant keywords. So you can be as you discover articles, you can say, oh, how did they talk about the concepts that I'm interested in? Have I got those keywords in my search? And it also helps you find out if somebody's already doing what you're doing. So there's no point in repeating a review which is pretty much identical to something that's 6 months or even less ahead of yours. So it gives you an opportunity to differentiate your review from other reviews that are out there. And also sort of like any articles that you discover, search for those articles in the databases you're planning on using and see how the database describes those articles. And that can also be a very effective way to discover more keywords for your question. So as I said, one of the things you're interested in, has the review been done somewhere else? Because you don't want to spend time doing something that's already been answered, but also you don't want something that hasn't been finished yet. So you'll be searching protocols to see if somebody is in the middle of doing what you're thinking of doing. You can also search for similar reviews, systematic reviews that you can then look at their search strategy and see what can I take from those to improve my search strategy. So all of those all those different streams come together to help you tease out how am I going to search? Because remember, one of the first things we said is that your search has to be exhaustive. You're trying to find all the literature for your research question. So don't underestimate how many keywords you'll need to search for that. Some of the places that you can start looking for information, if you're looking for healthcare related reviews, you can look at the Cochrane Library or the Cochrane Collaboration. If you're looking for education, crime, justice, social welfare, international development, the Campbell Library is someplace you can look. If you're looking for pre-registered protocols in health and social care, Prospero is a good place to look. We're seeing a lot of people now using the Open Science Framework for non-health related systematic reviews or other types of reviews in the Open Science Framework. And also you can go out to the databases themselves and do your search and add either, usually there's a limit that you can click for systematic reviews or explicitly search for systematic reviews in the database to help you identify the material. One thing I will say is don't underestimate how long it would actually take for you to run your search for your review. It's not something that's going to be done in an afternoon. It may take you a number of weeks until you're satisfied and the team is satisfied that we're finding everything for your review. The golden article, you can use the bibliography to locate related articles. You can use the cited reference search to see who's used it after publication. You can look for it, as I said earlier, in a database to see how the database describes it. And if you have a number of golden articles that you think, I would love these articles to be in my search, they're a checklist of how good any of your searches are. So if you have 20 articles and only 10 of them are coming up, look at the 10 that are not coming up and think, well, what keywords can I take from those articles to add them to my search. As I said at the very start, one of the things you will have to do is you will have to come up with a plan. You'll have to make that plan publicly available, and that's your protocol. Your protocol is a predefined plan that acts as a roadmap for your review, detailing the objectives, methodology, and procedures to be used. It should be prepared before review is started and used as a guide to carry out the review. So if you're saying you're doing something, this is how you're going to do something in your review, and you put that into your protocol, you make your protocol publicly available, then you've got to follow that. So you have to think hard about what is the best way to get from A to B and further in your review. They should be made publicly available. So there's no point in you doing it and holding on to it. It has to be made available. And you can register it in a registry such as Prosper or the Open Science Framework. There's a variety of things you will be covering on that. You might be covering the rationale, where you're going to search, how you're going to search, your inclusion-exclusion criteria. And these are how you would look at an individual article and how you would decide whether the article is staying in or it needs to go. So is it a particular type of study in how you define the participant, the intervention, what outcomes? And you need to, one tip I will give is be really, really clearer than you potentially think you need to be, because remember, it's a team that's looking at this, and the ideal review in 5 years, somebody else who you've never met could be updating it. So you need to give them enough context so they know exactly why you did things and how you did things. So make sure that it's not your shorthand to describe what you're doing. Make sure that it is going to be clear to a random third party who's interested in your topic. And this is just an example of a potential inclusion-exclusion criteria. But it'll all change depending on your own specific inclusion-exclusion in your own question. So there's some links here on Prospero, how to register a protocol in Prospero, if that's what you're doing as well. So I'm going to pause again just to see if anybody's got any questions. Please let me know if you have any questions at this stage about anything. So, sorry, Breda, could you explain that question for me, please?
Sorry, I left out the word Prisma, Dermot. So the records that are excluded, do you need details on the higher number of exclusion? So say you had, on your example on the slide, you had 2,115 were excluded. But obviously, it got a bit like long, the Prisma, but you know, do you have to?
No,
Yeah.
you only need to give that at the full text.
Full text, yeah. That's what I thought.
You don't need to say why something is going for title or abstract, but you need, one of the things you need to be very clear is you need to have very prearranged reasons for excluding things at the full text.
Yeah.
Thanks, Breda.
Thank you.
Was that it? Was that anything else, Breda? Terrific. So there's also a question from Niall about where do you need to register a protocol for a scoping review, and where do you do it? There's a number of places. I think the Joanna Briggs Institute, I think you can register protocols there, or the Open Science Framework. It depends on the topic. In some journals, don't ask me at the moment what those are. You can even actually make a scoping review protocol, and it can be a publication in some journals as well. If you're a HRB funded researcher, you can also, they have a HRB Open, which is their repository, and you can upload your review there. The great thing about all these sites is they're scraped by Google. So if you do a Google search with keywords, you should be able to discover them readily at that place as well. And Sarah, so if you've got a year, you need to be very pragmatic. How big a team have you got? Is it a year, or is it something you're fitting in with everything else that you're doing as well? So a rapid review springs to mind. But you'd have to have a good thunk. Is it feasible to get it done at a level that you'll be comfortable with and be able to stand over? Because these are all would be, if it's been published, they will always be open to peer review. There are many journals, Dan, that publish systematic reviews and scoping reviews as an article. Yeah, and I'm quite happy. I don't have any off the top of my head, but if you want to email me afterwards, we can have a discussion about that. And Lula, generally, no. If it's just one person, it's not really a systematic review, because the reason it's team based, it is to make sure that it's free from bias, comprehensive, etc. So generally, no, it's not just one person. Okay, so I'm going to continue on. Okay, so selecting your sources. Earlier on, I said make sure you do select the right resources for your question. These are some of the databases. This is not an exhaustive list, it's only an indicative. For health, some of the standard ones we see are PubMed, Embase, CINAHL, PsycInfo. Social Sciences, ASIA, ERIC, PsycInfo, Social Sciences Citation Index. For Grey Literature Report, Linus, Base, Bielefeld, and then as we talked about, hand searching and looking for journals not contained in the databases. Also, you need to be conscious of the fact that a lot of the databases that we subscribe to here in UCD are, by their nature, they're first world English focused. If your question is potentially beyond the scope of that or wider than that, you should be considering other sources that bring material from in other languages in other parts of the world. And this slide here has got some links to some of the resources that in various parts of the world that could be useful. So one of the key things to help you when doing a scoping review are what are called frameworks. And frameworks are mechanisms for looking at your question, breaking it down into component parts. And then that's the framework for your search strategy. The classic one for systematic reviews is PICO, which stands for Patient or Population Intervention, Comparison, and Outcome. So you look at your question and see, what are the characteristics of your patient? What is the intervention? Am I comparing another intervention? That would be the comparison. And then what are the outcomes that you're interested in? And then you start thinking of all the ways of describing that population, the intervention, etc. If you don't have a comparison in your question, don't worry. Quite often, there is no comparison, but it is there if it is suitable for your question. And once again, PICO is not the only framework that's out there, and it may not always be suitable for your specific question. If your review is qualitative, you could consider PEO. That's population, the problems, the exposure, and the outcomes or themes. SPIDER is qualitative also, and the S stands for sample, phenomenon of interest, design, evaluation, or research type. I've seen this a lot. This is very popular for scoping reviews, and that stands for, it's PCC, and that stands for population of participants, concept, or context. I've seen other ones. My personal favorites are CocoaPop and Behemoth. So there are a lot out there. So make sure you pick the right framework for your question. So when you're thinking about your keywords, brainstorm. Remember, it's a team-based. Use it to source. Think of about as many relevant keywords. You can always remove them at a later stage. Use previously discovered systematic reviews. It may not be the entirety of your question. You could just search for, if you're doing something for autism, just search for autism and you don't care what the what aspect of autism you're checking for, but you want their search strategy for autism. Use the golden articles as we've already discussed to try and see what keywords are given to articles you know about. It's all really helpful in helping you think of terms you haven't already thought about. And these are the kind of things you should be thinking about when discussing your topic. Are you aware of alternative vocabulary? There's usually multiple ways of saying something. So you need to step beyond what you currently know about your topic and think about what are people around the world, what words or phrases are they use when they're writing about the concept you're interested in. Be aware of Irish and American variations in spelling words like color or labor. It can also be medical English, pediatric, subtle differences there. The databases are very powerful, but they're also very literal. So if you tell the database to search for color with a U, there's no guarantee it's going to search for color without a U, and you could miss research. If you're searching for multiple words that are very similar, you can go back to the stem of those words and use a technique called truncation, and that would replace all the potential endings with a symbol. So the example here, we've got child with a $sign, and that will find you child, children, childish, children's, childhood, etc. But all you'll have is just child. If you're searching for words or phrases that have abbreviations or acronyms, make sure you search for both of them. So if you're searching for University College Dublin, search for UCD as well. So we're going to do a little exercise, another exercise. I'm going to share you a link at the moment. So our potential question is, does social distancing reduce COVID-19 infection rates? So I applied PICO. My problem is COVID-19. My intervention is social distancing, and the outcome is infection rates. So I'm going to put this link into chat for you. I've gone horribly wrong there for a second. Where did it go to? So give us 2 seconds. I'll put a link into chat, and if you just click on that link, and we'll go and have a look and see what words you can come up with for that. So let me know if you have problems accessing the page or the form. And once again, put in any words that you think would be good for social distancing, COVID-19, or infection rates. And remember, at this stage, there are no wrong answers. So remember when we were getting all those messages from the HSC about social distancing, what were they continually telling us? 2 meters, terrific. Fantastic, keep it coming. Now, thank you for all these. So one of the things you need to, and it's an issue we all face, is that we have to make sure that we're staying on topic. So you always have to refer back to the question. So the question is, does social distancing reduce COVID-19 infection rates? And one of the things put in there was washing your hands. That's nothing to do with the question. Obviously, you would wash your hands for infection, but here we're specifically looking at social distancing. And think sort of like, so you think, does your terms refer just to this? There's also there about vaccine. We're not asking if the vaccine works. It's just a social distancing. So always be checking against it. I mean, put it all down, but then go back and double check, is this really social distancing? And I'm glad to see, because one of the things is you spelt meters the 2 ways. So it's always looking out for those ways those words could be multiply spelled. Fantastic. Okay, so let's go back to the presentation. So this is what I came up with. So got COVID-19, 2019 nCoV disease, coronavirus, SARS-CoV-2 infection, COVID-19. If you're around on Thursday, I'll give you a really long potential list for all the ways you might need to search for COVID-19. It's a lot more than you would actually think. Social distancing, which we saw in the word cloud, but physical distance, 2 meters. If you're in England, 2 yards, whatever it is, whatever the distance is. Infection rates, transmission. So it's putting that brainstorming in is really important. And it's where the team comes in with the different perspectives to sort of make sure that we are thinking as thoroughly as possible. So this is what I do then. I take from that and I would create a document. The only purpose of this is to develop my search strategy. I lay out my PICO structure, and then I'll start putting in my keywords. The great thing about it being in a Word document, you can delete anything at any time. But also the great thing is I'm a terrible typist. So instead of typing in every time and having to spend 5 minutes or 10 minutes correcting all my mistakes, once it's done right, it's always going to be there. So I have got my search string for COVID-19. I've got my social distancing. I've got my infection rates. And I deliberately labeled this first draft because I can then go on and develop and improve this. So that's really where we're going to take it today. So let me just go back to that presentation again. So we'll be sending on the presentation. So do check out our systematic review guide. There's loads of information on the various types of reviews, frameworks, information on your protocol, critical appraisal, etc.